Hey guys, this is Dr. Vindhya Pai and today we are going to discuss about the common skin conditions in children that I see every day in my practice. So in India we have a lot of infections, and so we see a lot of skin infections starting from scabies, which is a mite which can present on the dorsum of your hands, of your child's hands, and it starts as itchy small lesions and it goes all around your body, and it's pretty itchy, and it's more itchy while sleeping at night. It also easily spreads in your household, so make sure that in case your child has this, visit a dermatologist. Make sure you get the right creams for it. The cream used is usually permethrin, and they have to use it just once below neck application, just once overnight, so make sure you use that. The other common infection that we see is hair lice. Now a lot of school going children do get lice on their head, and now that can also cause a severe scalp itching and eczema sometimes. So make sure that you visit a dermatologist, you get your scalp checked, and so you get the right shampoos and the aftercare for that, so that it is solved. And in case your house members also have it or your school friends have it, make sure they all get treated for it, because otherwise your child is going to get it, so make sure you get treated for that. Bacterial infections are pretty common, so you get a lot of pyodermas and impetigoes. Now these are small skin infections which can present as yellowish crusts on the skin, and these are also pretty common, and we do get to see them. Antibiotics and antibacterial creams definitely help this condition. Now we also see a lot of disorders, like for example atopic dermatitis. Now this is an inflammation of the skin. It's not an infection per se, but it's because your skin is unable to produce enough oils, and that's why your skin is extremely dry, thereby allowing all the external allergens and irritants entering your skin, thereby making your child itch, especially in the neck, around the eyes. They start rubbing their eyes in these kind of folds, elbow creases. They start to itch because these are areas where the allergens can accumulate. So the environmental allergens like pollens, dust, all these accumulate in your neck creases, around your eyes, and also on the elbow folds, on your knee folds, and all these regions. So basically it kind of accumulates there, and they start itching. In a really small child, while they are crawling, they can definitely have it on their extensors of the hands too. They start itching, they do get a rash. So the treatment for this is basically moisturizers, using the right type of moisturizers, using the right type of soaps, and the clothing will definitely treat this condition. Now the other form of condition that we see is known as polymorphic light eruption. Now this is mainly because your child is not applying sunscreens nor applying any moisturizer. When he or she goes out in the sun and plays, definitely sunlight has a role on your child's skin, thereby producing uneven skin tone, hypopigmented, which means like whitish skin rashes all around the face, and that can also get itchy. So the treatment is moisturizers and using the right amount of sunscreens. Sometimes also an anti-inflammatory cream does help. Now there are some yeast that grows on our body, and in humid conditions, when they're sweating too much, it can get activated. Now these are known as pityriasis versicolor or pityriasis alba. Now these are all scientific terms. You don't have to worry. These are simple skin problems that occur in children, can be easily handled with antifungal creams and the right soaps and cleansers. So in brief, these are the common skin conditions that I see in a child. I must have forgotten a few, but these are in general the common ones.